Good morning, all. Welcome to today's Cancer Healing Journey Talks. Myself, Annie Jose from Community Outreach Team of ZenOnco.io and Love Heals Cancer. Cancer Healing Journey Talks helps cancer survivors and caregivers to share their journey with vast number of survivors and caregivers who have traveled or been traveling through this journey. This can inspire and motivate them for their faster recovery as well. I would like to introduce today's speaker, Mann. He is a chronic myeloid leukemia survivor. He is also a patient advocate, and he provides education to leukemia patients regarding the bone marrow donation. And yeah, so welcome to today's session, Melman. Over to you.
Well, thank you for having me. Yes, I'm a patient advocate, and yes, I provide awareness as far as leukemia, bone marrow donation, and also clinical trials. So I was diagnosed with chronic myeloid leukemia this month, January of 1995, which is 27 years ago. And what happened was I had taken some tests before Christmas, before the holidays over here in the United States, because that's where I'm living at, and that's where I was diagnosed and born and raised. And I was living in a place called Michigan with my wife and my 5-year-old daughter. And I went in to get the results of this test after the holidays, which was in January. And the reason I had taken the test was because I had back pain and I had some fatigue, which I really didn't think a lot about it. I didn't think that it meant anything that was going to be a serious medical problem. So, I just walked into the doctor's office to get the results, and the doctor gave me the results. And what the doctor said was I had chronic myeloid leukemia, CML, and at the time they also called it chronic myelogenous leukemia, but it's been shortened to chronic myeloid leukemia. And he said I had 3 years to live. And I'm getting all this information and I'm trying to process it. And it's coming in kind of broken. He's sitting at his desk. I'm sitting on the couch, which is a little bit lower than what he's sitting at. So it feels like I'm sinking down into the couch. And like I said, I'm in shock. I hear this thumping sound. And it sounds like a big boom, 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 boom. And I turn my head and I look up on the wall and there's a big one of those clocks. And it was like the second hand that was ticking. That's how much shock I was in. He kept talking and he said, I had 3 years to live. That's the prognosis for patients who are diagnosed with chronic myeloid leukemia. And that was 1995. And he said, my only possible chance for a better outcome was to have a bone marrow transplant. And he said that a sibling, a sister or brother, was my best chance to find a match. And also he said that minorities would have a difficult time finding a match. And this is 1995. Basically, everybody had a difficult time finding a match because there's probably less than 1 million people on the bone marrow registry at the time. Today, there's 23 million people on the registry, but not everybody finds a match. But he kept talking. He says, well, if you find your match, you have a 50-50 chance of a better outcome. Now, he didn't say like, you're going to live for a long time or whatever, but a better outcome. Some people are cured, but he said a better outcome. And he said, but you could develop something called graft versus host, is when your body rejects the marrow donation. And if that happens, then you could die from the procedure. So I'm still in shock, and it's hard to believe what he's saying. And so he keeps talking, and I've got one sister, and so I'm thinking about my odds, and they didn't seem very good. And I'm thinking about my 5-year-old daughter, because with 3 years to live, she's only going to be about 8 years old if if this prognosis is right. So all this is going through my mind. How will I tell my mother this diagnosis? And so we're back home, told my wife, and she becomes upset, starts crying, and then I was in the army, stationed in the army at the time. I was a major, and so I went into work and I told the folks at work. But what the doctor said, that I had to come in, see a specialist oncologist, because this to really see where I was sitting at, get a definite diagnosis, because they had to do a bone marrow aspiration. When they take this needle and they stick it in your hip, and to confirm that it is CML. And when they did that, they did confirm it was CML, and there was a change in the DNA. And so that's how they confirmed it. But I still was in denial. So I went and got a second opinion. I flew out to a different state, to the nation's capital, to a place called Walter Reed Hospital. And they confirmed that it was CML. So that's when I started treatment. And the treatment that I started was called interferon. And I had to take daily injections of interferon. I had to take them in my thigh, arm, in my stomach. And there was a bunch of side effects from the interferon. So meanwhile, my sister took a test and she did not match. And then in addition, once she did not match, we checked on the registry and no one on the registry matched. So I decided to do bone marrow drives. And the organizations that I checked with at first, they said, it'd be better for someone else to do these drives for you. But I thought it would be better for myself to do the drives. They said, well, it's going to take a lot of energy. It's going to take a lot of your emotional energy also. But I said people will probably respond better and quicker if I asked them myself to be a donor. So I did a bunch of drives all over the United States, and I did drives at military bases. I did drives, bone marrow drives in churches. I did drives at malls. I did drives with different groups of people, and I kept doing it. I did that for a long time. And meanwhile, I had to retire from the Army. I took a medical retirement, and I moved down about 600 miles south to a state called Georgia. And I started doing the drives down in Georgia. And it was like a full-time job. I was a volunteer, whatever. But I would wake up in the morning, meet with some folks, and we would go out and do these drives. I forgot to mention that when I was up in Michigan, I had a lot of support from my coworkers. They all, they went out and they were tested to see if they could be a match, and it was hundreds of them, and no one was a match for me. There were matches from these drives for other folks, but not for me. And once I moved down to Georgia, I started doing the drives, and my aunt, and I had other people doing drives for me. So, it's a whole bunch of folks, a big team of people trying to find me a marrow match. And my aunt, she started doing drives too, and she was doing this one drive in a city called Columbus, Georgia. And I went to the drive, and this guy, he came to the drive, and he had a type of leukemia called hairy cell leukemia, which is different from mine. But he said he had been near death, and he went out to a major cancer city in a different state, about maybe 600-700 miles away. And his leukemia, was turned around. He was doing fine. And he recommended that I go out to this place. And, because he was saying, like, you got to do this quickly because one cell becomes two, one cancer cell becomes two, two becomes four, four becomes eight. And he gave me the information of the place that he went to and his doctor. And I started talking with his doctor, and the doctor told me to come out. So I flew out to the place was in Houston, Texas. I flew out there, and I started doing clinical trials. And the doctor looked at my record, and he said, "Well, and this is like halfway through my diagnosis. I mean, I've only got 3 years. I'm already at the 18-month mark." And he's looking at it, and he says, "Well, we still have time. I'm going to increase your dose of interferon. I'm going to try combinations of drugs, and I'm going to put you on clinical trial after clinical trial." So that's what I started doing. Every 2 or 3 months, I would go back and forth to MD Anderson, which is the name of the cancer center. And I was also doing these drives, these bone marrow drives at the same time. I mean, it was like thousands and thousands of people would sign up, but I still not find a match. My best friend, he was a match for someone. I was able to go with him when he did the procedure, and that was just awesome to see that the drives are working. I just couldn't find a match. So it came to about the 3-year mark, and I've tried different trials also. I've tried different drugs that worked for a little bit, but they would not continue to work. So about the 3-year mark, which, that's all I was given, I asked the doctor, because all the drugs eventually stopped working. I would wake up in the morning after sleeping 8 hours, and I would feel just as tired as if I never went to sleep. No amount of coffee could help. No, nothing could help. So he says, "Well, we've got this one drug. It's close, but we're having problems in the lab with it. And if it ever gets approved to be used for experimentation in humans, then I will let you know." So I flew back home, and that was really my last chance. And but he called me about 8 months later, and he said, well, about 7 months later, and he said they got approval to use that drug. So I flew back out to Houston, and I started using that drug. I was the second person to use the drug at Houston. It was like 3 different places of 20 people. It was in Oregon, and Texas, and California. That 3 places were 20 people each. That's all they would let use it initially, a total of 60 people. And of that initial amount, I started on a very low dose, but I responded. The guy before me did not respond. He died, and I responded. And I responded so well that about I went out there in August of 1998, and I responded so well that by June of 1999, I ran a 26.2 mile marathon in Alaska. And I did that for our blood cancer organization here in America called the Leukemia Lymphoma Society. And about maybe 4 or 5 months later, I cycled 111 miles. So the drug worked. And instead of people dying, they were living. And what happened, that was 1998. Well, I was diagnosed in 1995, given 3 years to live in January 1995. And then it became January 1998. And I got a little bit more time. And then I started in 1990, August 1998. But the drug was not approved. It took another like almost 3 years for that drug to be approved for everybody to use that drug. So, if I had to wait until everybody or got approved for everybody, I would have been long gone. So that's why I advocate for clinical trials, because you're getting tomorrow's medicine, you're getting that medicine sooner. You're getting tomorrow's medicine today. And that's what saved my life. And I am the longest living person in the world on this drug. It's called Gleevec and Almatinib. And it's also called what they call a TKI, a tyrosine kinase inhibitor. And it works, for other cancers. And then there's different generations of it. So that drug has like evolved and improved. I'm still on that drug, but there are different drugs that are better than that drug. And then the drug is so good that it's helped millions of people. And that's just just overwhelming and fantastic. And my daughter, she was 5 at the time, and she grew up, and she's a doctor herself. She's a physician, a psychiatrist, and just it's just been a great success story. It's had trials and tribulations along the way, but for the most part, I've been very blessed to have been on this journey. I've met a lot of patients, and I talk to a lot of patients as part of various organizations, and it's good to encourage them and listen to their stories. So that has been my journey, somewhat in a nutshell. That's it. Yes.
All right. Thank you so much, Melman. So that was a wonderful journey to listen to. So I have one question. Like, if you want to sum up your whole journey in one sentence, what would that be?
If I wanted to summarize that in one sentence.
Yeah, summarize the whole journey in one sentence, which always motivated you. So what would that be?
Well, I would say you have to maintain hope, because hope keeps you hanging in there, because you hang in there, what you have may not be working, but it may get you to the next step, and that may get you to another step to eventually you get the drug that works. And so summarize it in one sentence, yeah, hope. And everybody's different, so I have to keep in mind that even with CML, everybody's different. People respond better, some respond not as well, but I would say just maintain your hope, keep your hope, because no one knows the future.
That was wonderful. Thank you so much, Melman. So I'm pretty sure that this session will really motivate people out there who have been traveled or like currently traveling through the journey. So thank you so much once again.
Well, thank you so much for inviting me and having me here.
All
Thank
right.
you.
Thank you.